Hi, welcome back to the channel. On today's episode, we're going to talk about something that I feel frustrates a lot of doctors working in Nigeria. In all honesty, I feel like it's safe to make that generalization, but well, you'll be the judge of that at the end of this video. So, take for instance, you're managing a particular patient in the hospital, whether the emergency department, obstetrics, gynecology, whatever freaking department you find yourself in, and the patient's relative happened to be a medical doctor working abroad. Yeah. We'll talk about for the ones working here, but take for instance, it tends to be a medical doctor working abroad. And in the course of managing this patient, the patient is now all stable, maybe came in very deteriorated and all of that. In the course of your managing the patient is now stable, doing quite well and all of that. And the patient relative now calls you on the phone. Well, yeah, speaks to you on the phone and starts telling you, I hope you're doing everything you possibly can, talking to you with derogatory remarks here, telling you this is how we do things over there in the abroad. I hope this is what you're doing and all of that. The person is not calling you to ask you, well, what's up, what is the current status of things, what is happening, and all of that. The person is blatantly telling you this is what you're supposed to be doing. Is literally trying to tell you your job description. Even my consultants in most cases have had a lot of encounters like that, and it has made them to not even want to talk to that patient relative because there are already patient relatives around. So how many patient relatives do they have to be talking to all the time? But a lot of times, yeah, from my experience, most of these people don't talk to you like you are, like you know what you're doing. That's the kind of angle they always come out. The last case I had, the last situation I had of such, it was very annoying. Do you get? But I don't know, for whatever reason. I think I wasn't bothered by how he was talking literally because, well, I've done everything I possibly can for your pay for your relative, and your relative is stable. Do you get? And then yeah, and that was it. But to call me and be talking to me in that kind of tone, very annoying. And I feel like if I can be talked to like that, how much more a lot of my other chiefs, senior colleagues, even consultants, literally, that are being called on the phone and being spoken to very carelessly. Now, I want to make a distinction. Every doctor in every place, no, irrespective of where you work in, deserves the same kind of respect. You don't respect or talk to a particular doctor in a different form because he works in a different environment. Maybe you feel like the doctors in the US and the UK, well, they are better, they are, yeah, they are more qualified than the doctors here. Mind you, you yourself, you were here in the first instance before you wrote your exams and japad and everything. So it doesn't sit well, or it doesn't show you in a good light, because I don't feel it speaks to your character. It speaks to the kind of person you are. And if every freaking doctor that have japad continue to call the patient relatives and speaking in this light, do you feel like more people would want to even talk to you? Do you get? Do you feel like more doctors would be comfortable enough to even hear whatever it is you have to say? Yeah, that's one thing I need to point out, because number one, I understand that in managing a particular patient relative, there may be some instances, okay, another patient relative is also maybe a consultant, or specialized in the field and all whatnot, and is trying to understand there are two reasons I feel why a patient relative who is a medical doctor is trying to call you. Three, let me say three, for us here working in Nigeria. The first one is that, number one is that, okay, they want to know what exactly is wrong with their patient relative. Do you get what exactly is wrong with their relative? Why did I keep saying patient relative? Number two is that, okay, they want to be able to know if there is anything they can add to it. Do you get? They want to know if there's anything they can add, like a collaborative kind of management. I don't know. I know that there's just only one doctor managing the patient, but it doesn't hurt to have a second opinion. And for crying out loud, is their relative. So maybe they are the ones that have been living with the person for so long. So they may be able to tell you better what exactly is wrong with their relative. Do you get my point? Yeah. So the third one, in now this doesn't really happen often, but on numerous occasions I've had this kind of experience, and that is that they are calling you to plead with you to give your all to their patient, to their relative. Because there's this notion about Nigerian doctors that number one, they are underpaid, they are understaffed and everything. So there's a tendency to want to not give as much attention to all patients, because well, you get tired at certain points and then you leave your job and everything. Or I feel they have this notion that there is a laissez-faire kind of attitude with which we manage patients, which I feel is wrong. Do you get? It's completely wrong. The mentality itself is wrong, and it's also wrong for you to give or for you to manage your patients in that kind of light, in all honesty. But sadly, that is the reality in a lot of hospitals, especially in a lot of teaching hospitals. Yeah, they have they have very few doctors managing a lot of patients. So most times, yeah, in as much as they've done everything they need to do for a particular patient, but if in all honesty, and I say this in all honesty, if doctors are to manage patients the way they are supposed to, like just give your patients your time that is required, yeah, and leave, and there's nobody to check up on the patient and nobody to follow up whatever investigations, yeah, if we are to manage patients like that, trust me, a lot of patients are not going to make it. The kind of medicine we practice in Nigeria, I know, comes with a lot of difficulty, comes with a lot of, um, well, let me reiterate, the kind of medicine we practice in a lot of places in Nigeria comes with a lot of difficulty. You have to go way and above for your patient. If your patient is in a very critical state, you don't just do the barest minimum. Say you requested for urgent PCV, requested for so so and so. Sometimes you have to push a little further to get things done for that particular patient. It's sad to say, but I feel this is the reality. I don't know, correct me if I'm wrong. We see this in a lot, in a lot of cases, especially in obstetrics and gynecology and all of that, where patients present late. Now that too could be the fault of the patient presenting late and all of that, going to other peripheral places before finally presenting to the teaching hospital for proper care and everything. And it's usually very sad to see. So I get it sometimes when a patient relative who happens to be a doctor is calling you to please just put in, look at my son, or look at my father, or I'm also a doctor. And it's good that you take care of your own, honestly, because you might be in the same kind of position some other time. But where I feel is completely wrong, do you get, where I feel you are literally getting it completely wrong, is to assume that the doctor spending his or her time managing your patient, managing your relative in Nigeria is not doing as much as they are supposed to, or is doing the barest minimum, or is not even doing their duty at all. And I feel this is mostly the assumption in most cases. Or maybe the person, or um to assume that you're not even doing anything, because that is the angle some patient relative has spoken to me from. And it's very sad to have that assumption. It's very, very sad. I don't know the kind of news, or the kind of the news you hear about the medical doctors, blah blah blah, and the working conditions in Nigeria. Of course, you know that we are literally overworked and everything. Of course, you know that, yeah, there are very limited resources and and limited facilities, literally limited materials to take care of these patients as much as we possibly can in a lot of these facilities. But don't assume that we are not doing what we possibly can in our own little strength. Now, if you feel like your patient or your relative is not getting as much care as you feel like they are supposed to get, why still keep the patient? Why still keep your relative in that hospital and be disturbing the doctors, be talking carelessly or rudely to the doctors that are giving their all to this your relative? And I feel like, yeah, this is becoming even more rampant. Yeah, I feel like we're going to continue to have this kind of situations in the next couple of months. We are going to continue to have more situations like this because a lot more doctors are leaving the country, and then we have very more few doctors he left here to take care of our grandfather, to take care of our siblings, to take care of our relatives that are left here in Nigeria. Honestly, we once had a conversation in clinic when I was in neurology posting here. Thank God for my neurology consultants. Yeah, thank God for my neurology consultant. We once had a conversation about this. He always wanted to know what our thoughts were in the long run, like after every like generally about every freaking thing, and especially things that concerned medical doctors. He was asking us a question about if doctors left the country, who will now manage our elders, who will now manage our grandfathers, our fathers, our mothers, because obviously we are not traveling with them. Do you get? And we know that healthcare is even more expensive over there. So if you think of the whole thing or the whole finance it to take to ship this person out and blah blah blah, you would much rather have somebody back home here managing this your patient. And we had a lot of cases like that. We had a lot of patient relatives who would call our consultants, hey, come, please, I'm bringing my father, or help me manage my, those kind of things, because they know they get good care when they come to him. So it's like, he's coming, or so that I honestly don't know. And it's becoming a very sad reality. He kept asking, who would now manage? In fact, I feel like he was anti-Japa. I don't know. At some point, he was because that's the kind of feeling I had. But he was always open to having these conversations with us, because his argument was that if we kept on leaving the country, who would now be left to manage our fathers? Who would now be left to manage our brothers, our siblings, our relatives, and all of that? And well, I get his points, but one has to do what is best for the person at that particular point. Honestly, my argument most of the time was that, well, we'll only get to go and come back later on and all of that. But I don't know. And good enough, we are seeing a lot of more people who are coming back to the country and trying to make good things off of their knowledge they've acquired over there and everything. And it's very good to see, honestly. So it pains me and it makes me sad a lot of times when I see relatives who are doctors in the different countries calling doctors back here who are taking care of their relatives, working their asses off and everything, and you're insulting this doctor or trying to tell the doctor that the doctor does not know what he or she is doing, or talking to them very rudely. It's if I'm not bothered, but then it tells so much about your character. Do you get? So please, it pains me when I see such. It pains me when I hear of such. Do you get? If anything, put in your 2 cents, put in your 1 or 2 cents. Let them know that, okay, I'm also a medical doctor. If there's anything that may need to be done for my brother, for my father, please do well to let me know. Blah blah blah. These are ways to go about it, and I understand too that sometimes it may not even be the way they are being spoken to. I know, Nigerian doctor, calm down. Yeah, Nigerian doctors, calm down. It may not necessarily be the way they are being spoken to, but it's like the audacity to even call me. I don't know. Everybody is on the edge and everything, but it shouldn't be, because in the long run, your major aim is that the patient you're managing gets the best possible care and does well. That should be the end goal. And I feel like if two doctors, if not 10 doctors are working towards the same thing, then fine. I feel everybody wins in that situation. So I think that is that. I really want to know if you've had this same kind of experience. If you've had, yeah, the same kind of experience, how you handled it. Yeah, and if you think moving forward we should even be entertaining such calls. But yes, we should, I think. Come on. Because even doctors, when we are managing patient relatives who have doctors that live here in Nigeria as well, and they come around to know how their relatives are doing, it's just courtesy to, explain or discuss the kind of the situation or the case with them and know what next, keep them abreast and all of that. It's just courtesy to your colleague and all of that. Yeah. So yeah, so let me know what you think, if you've had the same situation and how you handled it. I think that will be that for today's episode. I'll catch you guys much later on. I'll catch you guys next week, yeah. And do well to subscribe, yeah, if you are yet to do that. And give this video a thumbs up. And I shall see you in the next one. Peace.